Welcome back to the deep dive. Today, we're exploring a topic that's, well, deeply personal and often quite challenging for millions, the reality of infertility.
It really is. And it often means looking beyond standard treatments for extra support.
Exactly. So today, we're focusing on one of the most, well, studied complementary approaches out there, traditional Chinese medicine or TCM.
Right. And specifically, we're digging into that powerful combination of acupuncture and, crucially, customized herbal medicine.
Our goal here is really to understand how this whole system works, how it aims to fundamentally rebalance the body to support reproductive health.
And what really stands out from the sources the experts were looking at is this idea of synergy.
Yes. It's not just two separate things happening. It's presented as this coordinated effort.
That's the core concept. We're drawing on insights from folks who really specialize in this, licensed, board-certified acupuncturists, herbalists, like those at the Berkeley Center for Reproductive Wellness. They've been doing this for, over 2 decades?
Right. And they describe it beautifully. Acupuncture works from the outside in.
And herbal medicine works from the inside out. It's this dual action.
Outside in, inside out. I like that framing.
Yeah, captures it well. Clinics like that really champion this because it addresses the whole person, the whole picture. Acupuncture is like the immediate modulator, influencing the nervous system circulation.
Kind of setting the stage.
Exactly.
Yeah.
While the herbs provide that sustained internal nourishment, systemic regulation, they're really designed to work together to get at those underlying issues.
Okay, so let's unpack that outside-in part first. Acupuncture. When we talk about it for fertility, it's clearly more strategic than just, say, general stress relief. What's the core mechanism? What's it actually doing for the reproductive system?
Well, at its heart, acupuncture involves inserting these very fine, sterile needles at specific points.
Yeah.
The idea is to stimulate the nervous system, and that stimulation sends signals that encourage the body's natural healing processes and helps restore balance. Now, applying that to fertility, probably the biggest, most consistently cited benefit is boosting blood flow.
That makes immediate biological sense, doesn't it? Good circulation is fundamental for building any healthy tissue.
Absolutely. The sources emphasize that robust blood flow is vital for healthy follicle development, that's about egg quality, and maybe even more critically, for building a really receptive endometrioal lining. You need that good lining for implantation.
Right. The soil needs to be ready, so to speak.
Precisely. And we have research backing this up. There are studies, particularly with women undergoing IVF, showing improved blood flow to the ovaries after targeted acupuncture.
Okay, so it's not just a theory.
No. But it goes deeper than just improving circulation.
How so?
It's about communication within the body.
Yeah.
Acupuncture seems to influence the brain's central regulatory system, what we call the hypothalamic pituitary ovarian axis, or HPO axis.
Ah, the HPO axis. That's the main control panel for reproductive hormones, isn't it? FSH, LH, estrogen.
That's the one. It's the switchboard.
Hmm.
By influencing this pathway, acupuncture can help stabilize hormone signaling. And that regulation is especially helpful for conditions like PCOS, polycystic ovary syndrome, where that signaling can be quite erratic.
That sounds incredibly intricate. And we have to factor in the emotional side too, right? Infertility is intensely stressful.
Oh, absolutely. Profoundly stressful.
And stress hormones like cortisol, they really mess with that HPO axis, don't they?
They certainly do. High cortisol can directly interfere with ovulation. So this is where the stress reduction aspect of acupuncture becomes a really important, if indirect, fertility benefit.
How does it do that?
By stimulating endorphin release, it helps calm the nervous system, kind of puts the brakes on that fight or flight response. It can help break that vicious cycle. Stress impacts hormones, which causes more stress, and round it goes.
Okay, so better blood flow, hormonal regulation via the HPO axis, and stress reduction. That's quite a package for preparing the female body. What about the male factor? Does this outside-in approach offer anything there?
Yes, the sources definitely indicate potential there, primarily around improving sperm quality parameters.
Okay.
And again, this isn't just theoretical. There are specific studies, like a pilot study from back in 2000, that found acupuncture could increase sperm density, especially, it seemed, in men where low counts were linked to things like inflammation.
Interesting. And it's about the quality, too, not just the count.
Yes, that's key. Other research, like a German study from 2005, looked at the actual structural integrity of sperm, basically, how well formed they are. They found improvements with acupuncture in men with idiopathic infertility, meaning no other obvious cause was found.
Right, so it's improving the building blocks.
Exactly. Now, The sources are careful here. They note that the evidence linking acupuncture alone directly to pregnancy outcomes in male factor cases still needs more large-scale trials to be conclusive. But the evidence for improving the markers, motility, concentration, structure, is pretty compelling.
That's a crucial distinction, improving health markers versus proving the final clinical outcome, like pregnancy. So it suggests the intervention is safe and potentially effective for improvement, but the journey to pregnancy is complex.
Precisely.
All right, that covers the acupuncture side quite well. Let's switch gears to the inside-out component. Customized herbal medicine. This seems to be where that personalization really shines in TCM.
It absolutely does. And when we
Right.
say customized, we really mean it. It's a dynamic treatment plan. It's not like taking a standard pill.
Right.
These formulas usually contain multiple herbs, often, 10, 15 different ingredients, sometimes more.
Mhm.
They're all chosen to work synergistically
Synergistically
based on the individual specific diagnosis within the TCM framework. Their unique pattern of imbalance. Maybe it's what TCM calls blood deficiency or key stagnation, or maybe there are immune factors involved.
Yeah.
The formula is tailored to that pattern.
So let's say a patient's symptoms change during their cycle, or maybe they move from just preparing to actively trying or starting IVF. The formula changes with them.
Exactly. That's the key. The formula is constantly reassessed and adjusted, maybe weekly, maybe biweekly. It adapts as the patient's condition evolves.
It sounds like having a personal health strategy that adapts in real time.
That's a good way to put it. This level of personalized adjustment provides continuous, targeted internal support. The goal is to build and maintain the therapeutic effects consistently over time.
That adaptability is really fascinating. What are these daily internal support mechanisms actually doing for fertility? What's the goal?
They're providing that deep foundational support. So things like normalizing hormone production, not by adding external hormones necessarily, but helping the body regulate its own production better.
Okay.
Also, critically regulating insulin levels. That's huge for managing PCOS. And modulating immune responses that can be really beneficial if immunological factors are suspected of interfering with implantation or pregnancy.
And just like acupuncture, are the herbs also focused on the uterine environment?
Absolutely. They work internally to improve blood flow specifically to the uterus.
Yeah.
The aim is always that thick, healthy, receptive endometrial lining needed for implantation to succeed.
And because they're taken daily.
Right. They provide that consistent therapeutic effect, bridging the gap between, say, weekly acupuncture sessions. It's continuous internal work.
Okay, this really brings us to the heart of it, the combined power. We've got the external modulator, acupuncture, setting the stage, and the internal builder, the customized herbs, doing the deep work. When you put them together, how does that synergy show up in terms of actual results, clinical outcomes?
Well, it really is synergy in action. Acupuncture improves circulation, calms the nervous system, makes the body more receptive, you could say.
Priming the system.
Yes, and then the herbal medicine comes in with the nourishing components, the targeted regulation, the consistent internal support. They absolutely reinforce each other's effects.
And the research seems to back this up, especially compared to conventional treatments on their own. What are some of the key findings without getting lost in, dense academic jargon?
The data is definitely getting stronger. For example, recent large reviews have looked specifically at patients with ovulation problems causing infertility.
Okay.
And they found that combining customized TCM formulas with acupuncture significantly increased both ovulation rates and, importantly, overall pregnancy rates compared to using standard Western medical treatments alone.
Wow. Okay. So not just better than placebo, but potentially better outcomes than the standard approach alone in those cases.
That's what those analyses suggest. And there's another meta-analysis focusing just on PCOS. It concluded that combined TCM therapies, sometimes including things like moxibustion or fire acupuncture, alongside herbs, were actually superior to using just a single therapy. It highlights the benefit of that combined approach.
Interesting.
And we also know from other systematic reviews that Chinese herbal medicine, even used by itself, can improve pregnancy rates compared to some Western treatments over a period of, say, 4 months.
Now, the sources also mention combining TCM with conventional treatments like IVF. It's not necessarily an either-or situation, is it?
No, not at all. That's a really important point. Often it's about integration and support. TCM can be very helpful in managing the side effects of conventional treatments, which can sometimes be quite intense.
Like what, for example?
A specific example often cited is reducing the risk or severity of ovarian hyperstimulation syndrome, OHSS. This can be a serious complication for some women, especially those with PCOS undergoing IVF stimulation. TCM aims to help regulate the body's response to those strong hormonal drugs.
Okay, that makes sense. So it supports the body through the conventional process.
Exactly. And when we look at studies focusing specifically on acupuncture during IVF cycles, particularly around the time of embryo transfer,
Yes, those seem quite specific. What do they show?
that seems to be a moment where acupuncture can really shine as a supportive measure. There was a landmark study back in 2002, the Paulus study,
I think I've heard of that one.
probably. It was one of the first big ones to show that patients getting acupuncture right before and right after the embryo transfer had significantly higher clinical pregnancy rates.
And has that held up?
Yes, that finding has been largely reinforced by more recent, larger meta-analyses. They consistently show acupuncture significantly improves both biochemical pregnancies, the initial positive test, and clinical pregnancies, seeing a heartbeat on ultrasound in women doing IVF compared to control groups or sham acupuncture.
So it seems to make the uterus more receptive right at that critical moment.
That appears to be the most likely mechanism, yes, enhancing immediate receptivity.
And one other crucial outcome we touched on, the potential to reduce miscarriage risk. How does the combined approach address that?
Well, because the whole focus is on building foundational health,
Mhm.
improving uterine blood flow, ensuring hormones are balanced, and crucially, managing that chronic stress that often accompanies infertility. It aims to create a more stable, nurturing internal environment.
So it's not just about achieving conception.
Exactly. It's also about preparing the body to successfully sustain a healthy pregnancy, creating resilience.
This has been a really illuminating deep dive. It shows how sophisticated and increasingly evidence-supported this holistic approach really is. So for you listening, the core takeaway here seems to be that this combined strategy, acupuncture plus highly customized herbal medicine, offers a powerful, well-researched tool. It aims to enhance reproductive health by balancing the body from both the outside in and the inside out.
And remember that principle we talked about, continuous adaptation. The whole TCM system, especially with the herbs, is built on health being dynamic, not static. Those formulas change over time. They provide daily internal support that's personalized and evolves as your body and your situation change. It's not a fixed one-size-fits-all plan.
That adaptability itself raises a really interesting question, doesn't it? It makes you think, what other areas of your health or maybe even your work or personal life could benefit from that kind of continuously tailored internal support system? One that adapts and evolves with your needs rather than sticking rigidly to a fixed plan.
That's a great thought to reflect on.
That idea of adaptive internal support, definitely something to mull over.